Hello and welcome to CMTV, episode 16. Where we going?
And I'm Alison Kavanagh.
So, Ali, what did you want to talk about in today's episode?
Um, Always interested in health and wellness. I've been doing a lot of research into particularly metabolic health, and it seems to boil down to the health of our mitochondria.
Interesting. It's quite topical. We've seen a lot of stuff on that recently, so it's going to be interesting to delve into that. I'm going to be looking at facet joints in the spine. So, this is really the joints between vertebrae. Kind of topical. I think we mentioned in the last podcast that we have our seminar on unlocking the spine, making sure those joints are moving properly. So, we're going to talk a little bit about that. We also have video up on our streaming, which is Watch HCD. So, check it out if you're not able to attend the seminar. Do you want to start with the mitochondria health and metabolic health?
Yeah, it's just fascinating new discoveries about mitochondria. So, first of all, what are mitochondria? These are often described as the powerhouse of the cell. They produce the ATP, adenosine triphosphate. This is the chemical energy that our cells need to carry out their processes and functions.
Mm.
About 10% of our body weight is made up of mitochondria.
Wow.
Yeah, so we have trillions of them,
Yeah.
literally.
Yeah.
We inherit them from our mother, and the health of the mitochondria seem to influence all sorts of processes within the body. And if they're not functioning, it leads to a lot of chronic illnesses.
Okay. So the mitochondria would oftentimes say that like a cell is like a microcosm of the entire person.
Hmm.
And the mitochondria would be considered one of the organelles.
Yes,
Yeah.
yeah,
So organelle just meaning like little organ.
yeah,
So if we think of that as having a function within a cell, but there's more than one, excuse me, there's more than one in a cell.
yes.
So we have multiple mitochondria in every single cell.
Yeah, the only exception is red blood cells. They
Okay.
don't have mitochondria. They're really plentiful in areas that are very metabolically active. So the brain, the liver, and muscles, they all require a high energy output. So literally, there's thousands of ATP being produced every second in every brain cell.
Mm.
So there's a phenomenal output required by the mitochondria.
Okay, so then it makes sense that they make up such a high proportion of our overall body weight because if there are trillions of cells in the body, and then every cell has multiple mitochondria,
Yes.
and then the most metabolically active tissue, like the brain, burns a huge amount of calories. The liver, slightly ghoulish fact, but this is one of the ways that they determine time of death. It's actually from the temperature of the liver because it's so metabolically active and it's deep inside the body. It cools slowly. I think most people are going to be familiar with muscles producing energy
Yes.
because when we exercise, we produce more energy. That gives off a certain amount of heat and we start to sweat.
Yeah.
So that's what most people would associate with when they're doing strenuous work or exercise, they start to sweat. So each of those are metabolically active. So we'd say tissues in the body that maybe consume the most calories.
Yes.
Okay.
So mitochondria, we can have 3 to 400 in an average cell, up to 25,000 in something like a muscle cell. So they really are quite plentiful, quite numerous.
Mm.
They they burn glucose, but they can burn fat
Mm.
and other substances, even amino acids, if it comes to it.
Okay. Starvation when your body gets to the stage of breaking down proteins for energy.
Yes,
Okay.
yeah.
Right.
So the health of the mitochondria is really relevant because they produce reactive oxygen species, also known as free radicals.
Okay.
So free radicals can be involved in the aging process. I think what's really important is to think of them nearly like an engine.
Mm.
And if we have too much glucose being transported to the cell, it's like the engine revving in neutral.
Okay.
And the cells then want the insulin to stop bringing the glucose to the cell.
Oh, it's like it's over revving the engine. Okay.
Exactly.
Yeah.
And then they become insulin resistant. They're kind of saying, no, we're overloaded here. There's too much glucose coming in, too much sugar in the diet, and we're going to resist taking in any more.
Oh, so that's happening at a cellular level. I think normally, even me now, when I'd have a reasonable familiarity with most anatomy, but I would always think of like the insulin resistance. You think of like the role of the pancreas. You don't really think of that as at a cellular level.
Yeah,
So it's happening at the cell level that
yeah,
there's insulin resistance.
yes,
Okay,
yeah,
and that's really closely tied then to mitochondrial function.
exactly.
Okay, because there's too much sugar in the diet
Yeah,
is the ultimate cause.
yeah.
Ah, okay.
that can really overload the mitochondria.
Mm.
But in terms of their function, they're now realizing that they're involved in inflammation in the body, both turning it on and turning it off. So it regulates stages of the repair process, even telling the mast cells of our immune system what to do at different times.
Okay, that makes sense because we talked in a previous episode about, I think it was episode 15, about how stretching has been shown to increase pro-resolving enzymes. And if stretching is influencing the muscle tone to a certain extent, because obviously a muscle has to relax to return to its normal resting length, you are actually changing maybe the metabolic requirement of that muscle. As a result, it may actually be the mechanism of the mitochondria that's influencing the local inflammation.
Yeah.
Wow, okay.
They're saying that in the last 2 decades, they're saying that they're involved in hormone production. So some of the enzymes that are involved in making cortisol, estrogen, testosterone.
Okay.
So they're even involved in our hormonal levels. So this can be an issue that can affect menopause for women
Mm,
if there's poor mitochondrial health.
wow.
Yeah, so it really has very far-reaching effects, but the most recent is the effects of the mitochondria in the brain, that they're involved with neurotransmitters and the levels of dopamine and serotonin. So
Okay.
having healthy mitochondria in the brain has a huge impact on things like anxiety, depression, OCD, and even the really serious ones like bipolar and schizophrenia.
Wow. Okay.
But they're saying that with Alzheimer's and dementia, alcohol and sugar can severely impair the mitochondria and increase the symptoms of those conditions.
Okay. Well, it would make sense that the health of the mitochondria would have such broad impacts because if the mitochondria is in every single cell, that's going to affect every single tissue, organ, system, all the way up the chain.
Yes.
So, mitochondrial health in, or we might say ill health in one area of the body might result in one type of symptom, in another tissue, a different type of symptom. So we can get this whole spectrum of illness because our mitochondria is not functioning well, because ultimately we're getting in too much refined sugar, really.
Yes.
I
Yeah.
presume you're going to talk about that later. Don't want to be jumping ahead.
Yeah, no, like diabetes obviously would be a classic example of the mitochondria dysfunctioning,
Hmm.
not handling glucose and insulin well. So
Okay.
there's just far-reaching effects of having good mitochondrial health. It, as you said, impacts every system in the body depending on the area affected.
Hmm. Okay. So did you want to maybe go to what are the things that are causing dysfunction within the mitochondria?
Yes, I think the biggest factor seems to be fructose.
Hmm.
So there's about 262 names for sugar in the food industry. Yes, it comes in many guises,
Okay.
but particularly fructose because it's highly addictive. It lights up the reward center in the brain, so it makes us want to keep eating it.
Does that tie in with what you were saying about dopamine? Because dopamine is very much kind of the reward
Yes,
uh,
molecule, if you
molecule.
want, or
Yeah.
neurotransmitter.
Yeah.
Yeah,
Yeah.
yeah.
Okay.
Um, so it's that the glucose the body can metabolize quite readily, whereas fructose goes to the liver to be metabolized.
Okay.
And it's 7 times more dangerous, if you like, than glucose.
Right.
Yeah,
Okay.
it really impacts the mitochondria. So it comes down to reducing sugar in the diet.
Mm. That's probably quite difficult now because of how it's added to so many foods, and then oftentimes kind of hidden. Even when people do go reading labels, it can be hard to discern.
Yeah,
And sugars, you oftentimes notice as well, when you're reading labels, they're listed several times.
yeah,
And again, most people probably know this at this stage, but it's worth mentioning that the order in which ingredients are listed in something is dependent on their percentage. So the thing that primarily makes up the food you're about to eat is going to be listed first.
yes,
And then things that are like tiny trace amounts are going to be listed last.
yeah.
So when you list sugar maybe in three different types,
Five or
it could
six.
be five or six, it could be much further down the list. Whereas if you grouped it all together and said, this is all sugar, it would probably be first, and that would really alarm people.
Yes.
Okay.
Yeah, so I'm just really interested in mitochondrial health and the process of aging and allaying chronic disease throughout life.
Because I think the goal is not just to live long, but to live healthy,
Yes,
to live
exactly.
to live well into advanced years.
Yeah,
So sugar in
yeah,
its various guises,
yeah.
fructose in particular,
Particular high fructose corn syrup.
corn syrup in particular. Okay.
Yeah.
And then what were the other things?
Alcohol does damage the mitochondria, especially excessive alcohol
Mm.
consumption. So they were finding in the States, kids as young as 5 have fatty liver disease because of the amount of sugar in their diet, that they have the liver of an alcoholic.
Wow, at 5.
Yeah, yeah.
Wow.
So it's really,
And people wouldn't dream of giving a 5-year-old alcohol.
no,
It'd be completely amoral, and yet you're going to give them a high fructose diet that's going to result in the same thing.
yes.
Wow.
Yeah, so just getting on top of the sugar is really the way to go for mitochondrial health.
Mm.
Reducing the sugar, uh, obviously sugar that you add to stuff, but reading labels.
Yeah. And I think the simple thing, and it's been talked about a lot, is avoiding the high processed food. That if you're cooking stuff yourself, if you're making things from scratch, you're using simple ingredients, you have a lot more control over what you're eating.
Yeah,
Whereas if you're buying stuff that is in any way pre-prepared, pre-processed, like we're not just
packaged.
talking about packaged meals, but any kind of pre-processing, you always run a greater risk of having more of these things stealthily entering your diet.
Yeah.
So sugar, particularly the high fructose corn syrup, alcohol. Some people would say, "Oh, I don't really eat much sugar. I don't really drink." What would
Yeah.
be the other factors then?
Fats, so particularly trans fats. There's been a huge awareness of trans fats, and they've been removed from a lot of our supermarkets
Mm.
in terms of removed from confectionery and so on. Because we said while the mitochondria mainly likes to burn glucose, it can burn fat as well.
Mm.
But taking in damaged fats will damage the mitochondria.
Makes sense.
So healthy fats like olive oil, avocados, oils from seeds such as linseeds or flaxseed,
Mm.
chia seed, those kind of things actually help the mitochondria.
Mm. You were saying oily fish as well, things like sardines and
Sardines, salmon, mackerel,
yeah.
trout, any of those good sources of omega-3 oils, um, coconut oil,
Mm.
MCT oil, those kind of things are all going to help the
Yeah.
mitochondria to
So
function.
trans fats are basically fats that have been damaged through processing, usually through heat.
Yeah,
It kind of twists the carbon chains, makes them mutate. I think we talked about this in episode 6. We talked a lot about oils and fats.
yeah,
Um, so a lot of people might say, "Oh no, I eat a pretty good diet. I don't drink much alcohol. I don't have a high sugar diet, but I have a sweet tooth."
yes.
So it might be confectionery, or sorry, that would be the sugar. They might eat something else that has
Savory, like,
savory things that has
yeah.
damaged fats. Okay.
So avoiding deep fried food would be important.
I think a lot of sauces as well. Like a lot of things like don't want to pick on any one thing.
Dressings and
Dressings.
sauces.
Dressings is a nice way of saying it. I was
Yeah.
going to say something else. Okay, so that's kind of the dietary factors. Then there was a couple of lifestyle things you were saying.
Yeah, we're kind of back to the stuff that we've talked about. I think our father, Don, did functional medicine before it was called functional medicine 40 years ago. And he talked about the answer to good health. He talked about getting fresh air. Oxygen is important to the mitochondria. Nutrition, eating foods as close to a natural state as possible. We're back to our whole foods, avoiding unprocessed foods, unnecessary sugar. Sleep. So getting deep sleep really helps to repair the mitochondria. Good
Okay.
levels of restful sleep.
So
They,
things like avoiding screen time late at night,
yeah,
developing good sleep habits, all that kind of stuff
yeah,
to promote good sleep.
yeah, and even not eating too close to bedtime. They say 5 hours is ideal, but even, 3 hours before going to sleep, because then your energy is going into digesting the food instead of going into repair. But the body will clean up the mitochondria when we're in deep sleep.
Mm.
So it'll actually recycle them, use the different parts, and make new ones. So we get brand new, fresh, clean mitochondria with deep level sleep.
Mm. And then the last item you were saying was stress.
Yeah, well, just on our answer to
Oh,
good health, the W is water, so good intake of water.
mm.
And they're looking at how mitochondria might affect the water in the cell itself. There's really interesting research on that.
Okay.
Living water, yeah.
Right. I might come back to that.
Yeah,
Yeah.
absolutely. E then in the answer is exercise. So it doesn't even have to be strenuous exercise. They're talking about zone 2 exercise for improving mitochondria.
Mm.
And this can be walking, ideally around the 10,000 steps a day,
Mm.
but a half an hour walking in fresh air every day. And it doesn't even have to be half an hour together.
Mm.
It can be 10 or 15 minutes, 2 or 3 times a day.
Okay. So somebody suffering with quite poor metabolic health, other complications that starting simple, just walking, like you said, it doesn't have to be you're going to do a 10K or join a gym or something, just start walking, just get moving.
Exactly.
Because presumably the poorer the person's health, you don't want to have a crash, a sudden change. It's that you want to implement manageable changes.
Yes.
And then presumably as health improves, you can start to increase the intensity of your exercise if you wish.
Yeah.
But a simple start point would just be move more,
Yeah,
walking.
exactly.
Okay.
And the or in answer was relaxation. So really key is reducing stress.
Mm.
So getting natural light into your eyes, walking barefoot even for a few minutes in the morning, uh, to reset your circadian rhythms. So cortisol can really impact the health of mitochondria. So we need cortisol in the right amount at the right time when we get up in the morning. But high levels of cortisol throughout the day can impact the mitochondria.
So really, I suppose we need to look at balancing each of these aspects. That you oftentimes find that some people are excellent in a couple of areas, and then maybe it's one particular thing, like the person who lives a healthy lifestyle, exercises, does all those things, but has really high stress and poor sleep, is still going to have somewhat impaired mitochondrial function,
Yes,
which is going to affect their overall health
yeah,
in the long run. So it's a matter of probably, rather than being obsessive about one of these, try to get a balance across the board.
that's it,
Yeah.
exactly. Yeah,
Okay.
the simple steps to being well today.
Okay. So getting onto those simple steps then. So
Yeah.
what kind of practical things could people do to improve the health of their mitochondria?
I would say reduce sugar has to be number one on the list, particularly fructose, the high fructose corn syrup. Reduce or, if possible, cut out alcohol,
Mm.
because they do really impair the functioning of the mitochondria.
Yeah.
Avoiding damaged fats, and the flip side of that, getting in the healthy fats,
Mm.
the olive oil, the avocados, the sources from oily fish.
Yeah.
The other thing that they found is intermittent fasting, that having a break and letting the body catch up with the repair process can really help the mitochondria. So there's a lot of research on this in terms of maybe a 12-hour window or a 16-hour window
Mm.
that you're not eating. So maybe you don't have breakfast and you have something around midday. So maybe between 12 and 8 p.m. is your feeding window,
Mm.
and then the other 16 hours you're not eating. They're even talking about fasting, maybe even intermittent fasting, that you fast for a day.
Yeah.
This would be a wet fast where you're still drinking water, but that can help mitochondrial health as well. So you might pick a Sunday
Yeah.
morning till Monday morning and do a dry fast.
Presumably that'd be quite a shock to the system. Like it's severe is probably not the right word to use, but it's very powerful maybe. That like with the exercise, you're not going to start running a 10K. You wouldn't start necessarily with a day fast. You might be better do the intermittent,
Yes,
like have a period of time where your digestion is getting a chance to catch up or repair.
yeah,
And then as health improves, looking at something like fasting. Because it's interesting, like a lot of the religious traditions will have some element of fasting at some point in the calendar,
yeah.
which is quite interesting. You kind of wonder how much of that was based on an understanding of a way to promote health.
Yes,
Okay.
definitely.
Yeah.
Yeah. Other things that can help are like cold therapy, like plunging into cold water, sea swimming, even a 2-minute cold shower in the morning.
Mm.
These things can help to improve mitochondrial health. Uh, Red light is being shown to have some good effects on mitochondrial health.
Oh, because it penetrates more deeply into the body
Yes.
because of the wavelengths.
Yeah,
Yeah.
exactly.
Okay, so it can actually affect right down into the cells and
Yeah.
affect the mitochondria. Okay.
Yeah, and they're even distinguishing between the mitochondria buried deep within the muscle and the mitochondria out of the sacrolema, the kind of just under the surface, and that they're more involved in regulating what's coming in and out of the cell and what's produced, and the deeper mitochondria just converting the ATP to ADP and back to ATP. It's nearly like they just have this really quick switch over.
Right.
Yeah, so it's fascinating how how well
Yeah.
these cells function when they're allowed to function properly.
Yeah.
So if I had to boil it down, I'd say get rid of the sugar, get rid of the alcohol, and start living closer to nature.
Very good. That's a nice simple recipe to follow. Somewhat more challenging than it sounds because it's certainly simple to lay out, but people just have to make a decision. What are you putting your time and your efforts into?
Yeah.
I think the cold shower one is interesting because a lot of people say, I just can't stand the cold. And what's interesting about it is really kind of testing yourself. You are using a controlled stress in order to help your body and your brain deal with stress,
Yes.
that you're becoming adapted to it. So you're actually better able to deal with stress. And the interesting thing is, after you get out of a cold shower, the air and everything seems warm by comparison. So even though you have that brief window of about 2 minutes where you are experiencing pretty significant cold, you actually feel warmer as a result. Your body is trying to combat that by heating up, but also your perception has changed. It's like carrying something heavy and leaving it down. Then the next thing you pick up that's lighter feels really light. So oftentimes these things are about a contrast, a baseline that you're comparing something else to. And when you've had that cold exposure, everything else seems pretty warm.
Yeah.
So if you like the warmth, you're only taking, a bit of the punishment up front, and then you'll actually feel warmer afterwards.
Yeah.
Which I always think is interesting because a lot of people just, they can't stand the cold.
Yeah, it does create resilience.
Mm. Great. Okay. So that's pretty easy to follow then, the kind of simple things you can do to improve your health today.
Yeah.
Is there anything else that you'd add about that before we move on to the sets?
It's a work in progress. I would mention Dr. Robert Lustig if you really want to get down into the weeds, into the nitty gritty of all the pathways and everything that mitochondria do.
Mm.
And Dr. Chris Palmer, his book Brain Energy, looks at the health of mitochondria for disorders such as schizophrenia, bipolar, that aren't responding to medication.
Mm.
He's based out of Harvard. He's an assistant psychiatrist, and he's doing phenomenal work on brain health. So things that will help with anxiety, depression, OCD, some of the challenges that people are facing to one degree or another.
Yeah. And as genuine recommendation, it's not that we have any financial
No
investment or sponsorship or
affiliation.
anything like that, no affiliation. Both of those you said, they go into a lot of detail though.
Yeah,
So for some people it might get a little bit technical, but for those who are interested in the technical side, those would be good
people
videos to
to,
watch and people to follow and books to read.
yeah,
Excellent. Okay, we talk a little bit about facet joints then. Is there anything else you want to add?
that's it.
Okay, well, like you
For the
said,
moment,
we'll
it's a
probably
work in
come back.
progress.
Yeah, we'll come
I'm
back and
trying it
talk.
out on myself as we speak.
Yes,
So
yeah.
I shall let you know.
So I suppose I was going to talk a little bit about facet joints. We might take a look at the anatomy. I was doing a seminar recently, and it just was, we were chatting about this as well. It's something that I've been aware of for years with James Earls, and we were looking at planes of joints within the spine and how they change it. Like I said, it's kind of topical because we have our Unlock the Spine coming up in a couple of weeks, sold out seminar, very, very busy, very popular one. But just have a quick look at the angle of the joints and how that's going to affect their function. I suppose, first of all, I would talk about facet joints are there really to protect your discs. So we kind of like a little anatomy model here. It's very little small, but we'll look at this in the rendering in a moment. So the joints exist between vertebrae and they really kind of limit movement. They allow a certain degree, but they prevent excessive movement because if movement was excessive, if we moved too far, we would start to damage our discs. So it is kind of protective. But those joints, wherever they are in the spine, need to be free to move. And when there is dysfunction, they can either get locked in a closed position or they can get locked in an open position. And both is dysfunctional. So maybe we take a quick look at the plane of the joint because I think this is quite interesting. Certainly I find it interesting being a little bit of an anatomy nerd. So here we see kind of just the axial skeleton. And if we look at the cervical facets here, we'll see that the line here kind of between C1 and C2 and even between the occiput, the base of the skull, and C1, that these are pretty much horizontal. Now, as we start to go down, we can see the angle begins to change. These lines become a little bit more steep as the plane of the joint changes. So cervical at the very top starts off almost horizontal. By the time we get down into the low back, I'm just going to change tabs here. By the time we get into the low back, these discs are almost vertical. Actually, let's take a look at thoracic facets. So here we can see that they're slightly angled, but they're almost vertical. When we get down into lumbar facets, these joints are really completely vertical. So what that means is it's going to facilitate different types of movement in different parts of the spine. Now, we mentioned about the discs. So in the center of the disc is the nucleus, this part here, nucleus propulsa, because it is kind of like a gel cushion sort of thing. And then we have annular fibers, and these kind of go in alternating rings. So in one layer, I always think of these almost like fences. They are angled at one diagonal, and the next layer is going at the opposite diagonal, and they go across and back like that all the way out to the surface. And that facilitates as well a certain amount of movement. So as the spine rotates, for example, some fibers will go slack and some will tension.
Mm-hmm.
If we move too far or we stress these, sometimes this gel center can start to push through. It starts to actually break down. It ruptures some of those annular fibers. And if it becomes severe, it can start to herniate and it can either push into the spinal canal where our spinal cord is, or more often out to the side where we get what's called a posterolateral bulge. People who've had MRIs will probably be familiar with that terminology. They might not have known what it meant, but it basically means to the back and to the side. Posterior to the back, lateral out to the side, because this area doesn't really have as much support. At the front we have a ligament and at the back we have a ligament. So anterior bulges and posterior bulges are less common, whereas these posterior lateral bulges are pretty common. I wanted to mention about ribs as well, because obviously this is what is one of the things that is a feature of the thoracic spine. Ribs connect to it. So we actually have 2 points at which they articulate. We've here, and then we've in at the vertebrae here. And the reason I find that particularly fascinating is that when they look at disc pathology, the most common place for people to have disc problems is in the low back, particularly the lower group of vertebrae. And then the next most common is in the neck. Of all disc bulges, only 1 to 2% are found in the thoracic spine. And the reason is actually the ribs, because the ribs act as levers. They move the vertebrae and help that vertebrae to, or sorry, the disc to hydrate in the process. Because over the course of the day, from the effects of gravity and from the effect of tight muscles, we can get a lot of compressive force on the spine. And that squeezes fluid out. The discs become dehydrated. Now, as the space reduces, it means that it's more likely for one facet joint to press on another. So when facet joints get locked closed, it starts to put pressure on the covering, the articulating surface, which is basically just cartilage. Let's take a look at this again. So when we look at the articulating surface here, this kind of cartilage can start to damage and get broken down. And that's going to result in joint inflammation, which most people will call arthritis.
Mm-hmm.
Inflammation at the articulation. So if this starts to break down because the joint is locked closed, it takes a while, but you will start to get pain at the joint. So locked closed facets will cause damage to the cartilage, as well as disc pathology and a number of other things. A locked open facet is going to be a little bit different because it's going to stress ligaments. So I think we talked about this the last day. We were looking at things like the SI ligaments, the sacroiliac ligaments here. And we said when ligaments get tensioned, they get quite painful. So the same thing happens with the ligaments between the vertebrae. If they get tensioned, they can get painful as well. Oh, here we see some of the nerves as well. We see a section of the spinal cord. I'm such an anatomy nerd. I find this stuff quite interesting, that the spinal cord tends to finish here, and then we get these branches of nerves. This is called the cauda equina because it kind of looks like a horse's tail. Equine, horse. Anyway, so the function of the facet joints, as we said, is to facilitate and yet to limit movement. So in some parts of the spine, you see this when people have a deep lumbar curve, oftentimes associated with tight muscles in the low back, like the erectors multifidus, quadratus lumborum, psoas. All of these can pull the spine into this deep lumbar curve. And that's not a good thing. It's like the vertebrae have moved too far forward. And so we can get this kind of compressive force. If you have a flat back in the lumbars, the vertebrae have moved too far back. The joints are locked open, and that person will be prone to back pain.
Yeah.
So it can happen in either direction. So really what we want to look at is how to restore movement within those joints. So if the problem is that the facet joint is locked closed, we need to get it open. And if it's locked open, we need to get it to close. Now, there is a certain amount people can do for themselves. Manual therapy, I think, is really useful because it can help to really what we'd say is normalize tissue texture. So it's not just about the tension in the muscles, it's are they stuck, are they fibrotic? So we want to get muscles functioning properly first of all, because muscles are primary stabilizers of joints. Muscles are what move bones. So if the bone is not in a good position, chances are there's a muscle pulling on it. So if we can normalize the tissue texture and then mobilize the joint so that it can both open and close, then we can get function back. But then it's up to the client to maintain that function. That they need to be doing mobility exercises. There's some great mobility drills out there, and stretching the particular muscles that were causing the dysfunction.
Mm-hmm.
I actually think that for particularly the low back, multifidus and psoas are probably the two most important.
Yeah.
If we treat those, the person can then do a certain amount of rehab themselves and maintain movement in each of those facet joints.
Yeah.
So if the facet joints are moving properly, we shouldn't have ligament stress. We shouldn't have any pressure on the cartilage. The discs are doing their job. They're supporting the spine. They're acting as shock absorbers. They're facilitating movement and all that kind of stuff. And that's really where we want to get to. We want to make sure that the spine is healthy, there is some pressure on nerves, and then the person doesn't suffer back pain. So pretty straightforward.
Yeah.
For some reason, people find that stuff very complex. And there is a certain complexity to it. I mean, there are things like the laws of spinal mechanics where they talk about coupled motions and things like that, non-neutral mechanics and all this kind of stuff. And it can get complex. But I think to boil it down, to make it simple, it kind of comes back to what we were saying earlier. Movement is really useful for the spine. Joints really benefit from movement. The muscles really benefit from movement. The nerves benefit from movement. The discs benefit from movement. So we want to have a certain amount of stressors, if you like, but also time to rest and recover. So we always say that, you don't want too much of any one thing. Coming back to the idea again of balance.
Yeah.
And when we think about how endemic back pain is, the statistics are about 80% of people worldwide will suffer an acute bout of back pain. Then we can see that this is a really, really relevant topic. And if we can simply get the tissue texture right in the muscles, make sure the nerves aren't being pressed on, that the discs are healthy and the joints are moving. It's that simple. I don't think that's overly complex.
No.
No. Okay. So we will go into some of the things like the spinal biomechanics, and we'll talk about those non-neutral movements and things. So again, I'd encourage people, if you're interested in that side of things, if you're a therapist, you can, like I said, access prior recordings that we have when we've run this seminar before, because it's a popular one, we've run it quite often. That's on Watch HCD, our streaming site, that has a whole ton of stuff on it. Or attend our next Unlock the Spine seminar. It can be really useful because we'll teach all of the assessment and treatment, and then the home care to maintain the effects of treatment as well in the long run.
Yeah. Really invaluable work.
Yeah. Anything else you think to add to that?
No, it
Might be
sounds
worth
spot
mentioning?
on. Fascia, obviously, that goes without saying. There's always the fascial component as well.
Oh yeah, yeah.
Yeah.
Because as you move, you will help to improve fascial health as well.
Yeah.
Oh, we mentioned about the plane of the joints. I almost forgot to say why that was relevant. So the angle of the joint is oftentimes going to influence the type of movement that happens as well.
Mm-hmm.
So where we have this kind of transverse, slightly tilting plane in the neck, we get a huge amount of rotation right at the very top. Partly due to the way C1 and C2 are shaped,
Mm-hmm.
that kind of the odontoid peg on C2, if we can see that, around which C1 is going to pivot. There's a certain amount of pivot happens between our skull, the occiput, and C1, but a huge amount of movement, 45 degrees of rotation happens here between C1 and C2. But each of the other joints contributes a certain amount to that rotation. So we have the most rotation in the cervical spine. We get a lot of rotation in the thoracic spine. And then because of the angle of the joints, we don't have as much rotation in the lumbar spine. But what the lumbar spine does a lot of is flexion and extension.
Mm-hmm.
So it's a different plane of motion where rotation happens in what they call the transverse plane. The flexion extension happens in what they call the sagittal plane.
Mm-hmm.
And then we get side bending and things as well, which is coronal plane. But the angle of the joint changing means different parts of the back contribute in different types of motion.
Yeah.
The reality is all of them will do a certain amount of everything. I mean, your neck does flex and extend. It's just the angle of the joint is going to influence which one it's best at.
Mm-hmm.
Because the thoracic spine as well, what they always say, rotation takes place in the thoracic spine. It flexes and extends as well,
Mm-hmm.
but not as much. It rotates more than it does those things. And the lumbars do rotate, but they flex and extend more than they rotate.
Yeah.
So that changing angle does influence the type of movement we would expect. And that means then if you're doing mobility work, if you're doing your home care, where the dysfunction is for you will then influence the type of exercise that might be best for you. So if it's in the neck, rotational exercises and side bending are probably going to be the best rather than flexion extension. If it's in the thoracic spine, a combination, a lot of rotation, some flexion extension. If it's in the low back, mostly flexion extension and a little bit of rotation, a little bit of side bending.
Yeah.
Yeah.
So that could look like maybe bringing the knees to the chest and maybe rolling them very slightly side to side
Yeah. Yeah.
when we're lying on our back.
Yeah. Particularly for the low back, bringing the knees up to the chest and actually pushing down on the knees to get those joints to open in the low back. That's a really useful home self-treatment, particularly when combined with heat.
Mm-hmm.
Oftentimes say, like, have a hot bath, get out and stretch. That would be a good stretch to do. Get back in the heat again.
Yeah.
Yeah. Excuse me.
Excellent.
Sorry. Anything else?
No, that sounds right on.
Good. Well, I think on that note, then we'll thank you for watching all the way to the end, and we'll be back again in a couple of weeks, probably following up a little bit more on mitochondrial health. But
Yeah.
if you guys have any questions or comments, let us know what you think.
Yeah. We'd love to hear from you. We'd love to hear some of your comments, some of your feedback on the subjects that we're bringing up to you.
Yeah. So let us know what you think, and we look forward to seeing you guys again shortly.